So I'm driving this morning to Sam's Club because I'm not a member, but they are having all healthcare workers can come in at 7 a.m. this morning and get groceries. So that's super awesome. It's nice to see the community doing things on a positive level and businesses to help. I worked yesterday and wanted to talk about the COVID testing. We still are having a lot of people call about tests and whether or not they can be tested. I had a guy yesterday come in who saw his doctor the day prior, and the doctor took a chest x-ray, and the doctor told him that he had a pneumonia, but he couldn't confirm whether this pneumonia was related to the coronavirus or not. I tried to get the copy of the chest x-ray. The imaging department was closed, and so I had to explain to him that if we can find another diagnosis, like the flu, one-sided pneumonia that looks like, a classic community-acquired pneumonia, that he would not qualify for diagnosis. So he came in, took a chest x-ray. It was in the left lower lobe, and just made sure he was on antibiotics. No fever, no shortness of breath, so did not do the coronavirus testing. Also was waiting on a test to come back for a patient who had the coronavirus test 8 days ago. The man still hadn't been back to work. He had called, he needed another work extension. I called the lab company and I asked them what was taking so long. They explained to me that it can take up to 8 days for the test to come back. And I said, okay, well, tomorrow would be 8 days, so I'm gonna have the test back by then, right? The lady said, no, it could be longer. And I said, well, how long does the test take to come back? And she said that she's seen up to 12 days for the test to come back, which is almost, the whole course of the disease is, around on average 14 days, of course, can be longer. So this was really concerning to me. I asked her what the issue was. What is the primary issue? The testing, the sample is not stable for only a certain amount of time, and it has to be tested. She explained to me that they are getting too many tests in at once, and they just do not have the capacity to test them in an expeditious manner. And they're trying to test them as quickly as they possibly can. They ordered a new machine, which apparently can test more tests at once, and the turnaround time should be a lot less. So a little bit discouraging. I know there's a lot of questions about tests out there. Can I get a test? Who gets a test? What are the criteria for testing? It's honestly up to what the general recommendations are of the CDC, but ultimately up to the organization and provider that sees you. So if you have any questions, leave them below, and I will be happy to answer them.